Hi, Mark Heim here, founder of Disaster Doc, talking to you today about Module 9, Flood Disasters. So let's go through those learning objectives again. After completing this lesson, students will be able to describe two categories of floods, identify the factors that influence the severity of a flood, identify major public health consequences of floods, and recognize the global scale of floods. Also be able to identify key public health and safety issues following a flood, should be able to describe how the risk of infectious disease outbreaks after floods differs among high and low resource nations, and identify the characteristics of flood-related mortality. Should also be able to recognize the health consequences of flood disasters, and finally, identify measures that will lessen the health impact of these flood disasters. So as I mentioned, there are two main categories of floods: flash floods and river floods. So there are characteristics of flash floods that we really want to be careful to understand, because flash floods are much more dangerous than the other type of riverine or river floods. Flash floods are rapid in onset, usually from rain or from structural failure like a dam breaking or other type of structure that releases a large amount of water. They're usually in brief duration. They happen and then they're over with. And they're usually associated with steep terrains where the water comes down very quickly and then narrows through a gully or a ravine, or actually through a valley where the water then picks up speed and picks up force as it's narrowed down. The other aspect of these flash floods, there's little or no warning. And by now, by watching these seminar, you know that little or no warning, much more dangerous when we're talking about disasters. People don't have any time, they don't have any warning, they can't get out and protect themselves and reduce their exposure by evacuation. So flash floods, we want to identify where those can happen, and then we want to be very vigilant of protecting people from those when they occur during these rain seasons or when there's potential for dam failure. Now, in comparison to flash floods, we also have river floods, otherwise known as riverine floods. And with these in particular, they're a little bit more slow onset. Now, they're not super slow, but in comparison to flash floods, of course, much slower. And usually it's a result of a prolonged period of heavy rain or a heavy snowmelt that then raises the water in these rivers as the water is being carried away. Typically, river floods are long duration, and even after the disaster happens and the river sort of breaks its banks and goes into areas where it shouldn't be, now it takes a long time for that water to drain back out again. So long duration disasters, and river floods can wear you out because it goes on for so long. They're usually associated with a concave terrain, so it's a bowl-shaped terrain where these things can happen. And I can remember one of the first disasters that I was in charge of the medical response for in North Dakota, where it was this huge, very, very shallow bowl that went for 50 miles, and we had this large area of concave terrain that was affected by these particular floods, large area of people that had to move from their home and become displaced. In addition, river floods are also associated many times with advance warning. So you can notice that the river's rising and rising and rising, and then it reaches a certain crest or the highest point. Hopefully that stops before it breaks its banks, but when the river comes out of its banks and goes in these concave terrains, then it can go for many miles. But at least we have that advance warning, which is really key when we're talking about saving people's lives. And now I want to talk about the importance of floods on a worldwide scale, because floods account for 40% of all world disasters. That's a lot. Floods are very, very frequent. They happen in nearly every country in the world. There are some countries that are actually spared from that, but even places where you would normally think aren't flooded, actually significant floods occur. For example, floods are a big problem in Saudi Arabia. Some of the major cities in Saudi Arabia have had flood disasters in particular. So it's surprising where they reach, but they are also far-reaching throughout the world. Floods cause the most damage of any natural disaster worldwide, and worldwide during the last century, the largest top 10 floods affected 1.4 billion people only in Asia. That's a huge percentage of the people in Asia. The costliest top 3 floods caused $88 billion US dollars in losses in Thailand and China, just the top 3. So we're really talking about a very expensive, very large area covered. This is a map, as you might recognize already. We're talking about these hazard maps through the entire seminar. I want to introduce that to you. I want that to be one of the things that from now on you know what these are, because they are really very key to us being able to preserve life, protect our families, and protect our livelihoods and our businesses. And flood risk can be mapped, of course, right? If you're near a river, you're near ravines and so on where floods can occur, you can identify that location ahead of time. And that's one of the beauties about this particular disaster is we can identify it, map it, and we can prepare in advance. So we have to think in terms of that. But I want to share with you in particular this particular hazard map of floods because it really shows the change in Asia when we're talking about other areas not associated with delta. So you can see the magenta in this particular map is actually delta regions. Remember, I've spoken before about the danger of deltas when we're talking about disaster mapping and hazards that occur in these delta areas. And so you can see, for example, up in the area of Myanmar, in the areas of Bangladesh and so on, in the Indian Ocean, on the Indian subcontinent as well, near that area where we look in South Asia and we see that flood of the delta area of the Ganges River. If you look down in this particular same map as well and look at the area in southern Vietnam as well, that is the Mekong Delta region as well. Once again, most prone for floods. When we look over into China as well, we can see the Pearl River Delta. Once again, flood-prone areas when you're talking about deltas. And so we'll talk more a little bit detail about deltas in the next coming slides. So the most lethal floods in history actually have occurred in China. Modern history, 1887 to date now, 2 million dead in China due to one flood. 1931, 4 million people lost their lives in floods. And in 1938, another 1 million people as well. So these have huge, far-reaching consequences when we're talking about the number of people that can be affected and the number of people out of those that can actually be killed by flooding. So they used to call one of these rivers China's sorrow because it would be such a bountiful existence when you're talking about what the river does to support agriculture, but also the other side of that, it would every so often flood and cause quite a bit of devastation and suffering. And so once again, these ideas of very lethal floods in the history, we have to recognize that floods can be huge, large-scale disasters. Let's talk about the relative health impact of floods as compared to other natural disasters. Once again, looking at that 50-year period between 1964 and 2013. 51% of all people affected by natural disasters were affected by floods. 52% of all people displaced by all natural disasters in the world were displaced by floods. So they have a large-scale impact on a global level. Also, 19% of injuries and only 6% of the deaths. You can see a lot of people affected, a lot of people displaced. However, relatively smaller when we're talking about the impact of injuries and deaths. I also want to share with you now the natural factors that contribute to these flood disasters, and I've already alluded to one of them, the topographical makeup of the land itself. So we know, for example, that the Mekong River floodplain and the Ganges River as well, these deltas really make it much more flood prone. Once again, it's a large river that when it comes down to the coastline, it splits into small different tributaries that then go to the coastline. And when that area floods now, those places in between the individual tributaries also flood so that it kind of connects these two splits that happen from time to time. And when that occurs, you can have these large-scale floods where there just is a long distance between any dry land, and that's one of the dangers of these deltas areas. So when we hear floods and deltas, we should think of very serious consequences and pay special attention to trying to reduce that disaster risk there ahead of time. So let's talk about this relationship between other disasters and flood disasters, because we know that hurricane storm surges, those storm surges of flooding that's created by a typhoon, cyclone, or hurricane, depending upon where you live, it has a different name, of course, but those can worsen flooding. So we have to think about it. When we look at these types of storms related to the delta areas, we really have to be very careful because that's when large-scale disasters can occur. There's also earthquake-related dam failures, for example, so we have to think in terms of floods after earthquakes. And also landslides and volcanic eruptions can also create significant flooding as well. So there are natural factors that contribute to flood disasters, and these include geological factors like, for example, the soil character. It's very difficult in many of the Pacific Islands, for example, have a lot of coral and a lot of loose sand and so on. So when the heavy rain comes, the water soaks into the soil very easily. But if that soil is relatively impermeable, it causes a runoff. Or if there's no soil at all, if we've put down blacktop and streets and highways and so on, and like in these urban areas, now we've changed that soil character, that ground character, and it allows for more runoff, meaning more propensity for floods. As I mentioned before, other geological factors, including volcanic eruptions, can also be associated with these floods. In addition, another natural factor that contributes to floods are the seasons. For example, monsoon season in many areas of the world. In South Asia, in Southeast Asia as well, the monsoons bring with it many, many days of raining. And that increased precipitation actually then builds over time, causes more of these riverine types of flooding events as well. Climate can also have a big difference as well, and some of the climatic changes that occur with El Nino Southern Oscillation that occurs in the Pacific Ocean, changes in the temperature of the actual ocean itself create changes and more propensity for floods in different continents around the Pacific as well. So we also have this climatic influence as a natural factor that contributes to more flood disasters, or La Nina, which actually causes less flood disasters in certain areas as well. And then there's just a topographical aspect of this as well. If you're in an incline, you're in a basin, you're in a canyon, of course, water tends to travel downward. And so we can expect to have more floods in these topographical areas, especially when we're talking about canyons where water can be funneled in. That's a high risk when we're talking about flash floods and high precipitation events where there's a large amount of water in a short amount of time. There are human factors in addition to these natural factors that also contribute to flood disasters. One of them is urbanization. When we move in and build a large city in an area that may have a propensity for flooding, we take away some of that soil, we replace it with concrete, we replace it with blacktops and buildings and so on. We have to think in terms of how that water is going to be channeled, where it's going to go once we have that urbanization occurring. If we're not careful with that, we can actually increase the propensity for floods in that particular city. And we see this in various places around the world where the actual urbanization, in places where there was no prior problem with flooding, once we urbanized it, flooding started to occur. In addition, mankind has impacts on the environment that cause deforestation, the removing of the forest. You know, forests, the trees, they break up the flow of the water itself. The water has time to be able to settle, nourish the trees and marshlands and so on. They gather that soil, water together in the soil itself. And so therefore, deforestation, when you remove those, it increases the possibility of having floods. Other things that also contribute to deforestation are overgrazing and other types of agricultural practices that once again remove the ability for the soil to be able to absorb. Overgraze an area, now there's no grass, there's no type of brush or no type of vegetation. Therefore, water tends to move more quickly, and instead of settling down in the soil, nourishing that soil as it normally would, it tends to roll off and become more of a flood-prone area. We also see improper construction. So if dams are built incorrectly, levees, different types of management of floodplain isn't done correctly, we can actually increase the flood risk as opposed to decreasing it. Other inadequate safeguards, for example, where we depend too much upon the levees, too much upon the pumps to run. We depend upon technology to keep us safe rather than trying to make a long-term decision. We try to maintain and hold back the floodwaters, and that puts us at higher risk as well. Now, I want to talk about infectious disease outbreaks when we're looking at floods in particular. And you know, seen a couple of the other lectures that I've done before, I've really hammered home this issue of infectious disease because in many cases it's just a waste of time if people think that there's going to be an outbreak, that there's going to be an epidemic associated with a landslide or a tsunami or an earthquake. It just doesn't happen. Don't get me started. But you know, with floods, it does happen, and it happens only, though, with certain factors that are in place. So I want to narrow that down for you so we can better predict that. There's a difference between the risk of flooding in high-resource nations and low-resource nations. I like to use the phrase high-resource nations to describe what people many times call the so-called developed world or rich nations. And low-resource nations, people say, you know, the developing world or poor nations. I think, poor and rich is a value judgment, and not necessarily everything that makes you rich has to do with money. A lot of it has to do with family. A lot of it has to do with community and just wellness and feeling good and actually being blessed in whatever existence that you have. So I use those ideas of resources, high resource and low resource, to describe what capacity people have to be able to draw from in order to make a difference in these events. So let's talk about high resource nations to begin with. Number one, here's the big take-home message. High resource nations don't have epidemics. They don't include diseases of epidemics when we're looking at these flooding events. We do see some infectious diseases pop up, but they're not the kind of bad things that you would normally say, wow, this is an epidemic, it's really super dangerous. What we see in high resource nations are things like self-limiting diarrhea. That means, people may get diarrhea for a small amount of time, but without medical treatment or without any type of antibiotics, they get better on their own. So many times they don't even need to see a doctor. Same thing for skin infections in these high resource countries. People can be exposed to floodwaters, get a little bit of skin infection and so on, which many times doesn't need a treatment of a medical personnel or a clinic and so on. Also commonly after these floods, people get a cough or an upper respiratory infection, more like a cold. It's not a pneumonia, it's not a lower respiratory infection. It's usually, cough and sneezing and sniffling and those kinds of things as well. Those pass among these, and we've noticed that in high resource nations like in the United States and other areas in Europe. But the issue in low resource nations is different. These do include diseases of epidemic potential. And we've seen diseases, for example, like leptospirosis that have occurred in the river areas of the Philippines is a good example. Or they've also even been associated with some of the areas in rural Hawaii. We also see dengue fever in these areas associated with floods from mosquitoes that may be infected that then pass that in low resource nations. Once again, this was in Central America where people already had dengue fever there, and that was worsened as a result of the flooding process. We've also seen elements of typhoid and cholera associated because both of those diseases can be carried by water. And it's usually improper sanitation, so toilet, sewer facilities contaminate that water, and then people are exposed to that by the floods, and they then get sick. There have also been cases of malaria, for example, that have been found in flood areas as well. Once again, all of these, though, in low resource nations. So with respect to flood-related mortality, I pointed out earlier that most deaths actually occur in flash floods compared to riverine floods. Certainly significant numbers of death associated with riverine floods, but between the two, flash floods more dangerous, as we discussed in the past. Also, death rates vary according to country. Low resource nations have higher rates of flood-related mortality when we compare those to high resource nations. The major causes of death for natural disasters related to floods: drowning. It's relatively easily. Of course, cleanup. There are some injuries that occur when people do cleanup and recovery. People, once again, using materials that they're not used to and so on. For the most part, overwhelming majority of disaster-related deaths associated with floods caused by drowning. So with respect to flood-related morbidity, there is a longer list that we have to be concerned about. Number one, flood-related injuries. We can be injured at the time of flood, but also cleanup activities also associated with a significant number of injuries. People shoveling out the mud, for example, inside their homes and trying to knock down walls and so on, or removing debris from their yards can always be injured when they're doing these things that are unfamiliar to them. They don't have the appropriate personal protective equipment. They're already anxious, they're already stressed, and so injuries do occur. So we also see this issue of toxic substances being released by floods. So floodwaters go through a factory or a storage facility, chemicals or other hazardous materials get carried by those floodwaters into areas where there could be potential exposure to populations. I saw one example of this where floodwaters went through a pesticide factory and then carried those pesticides over into the schoolyard where children would be playing. So we have to be concerned about that. After the floodwaters go away, we have to do some investigation, some analysis of whether or not there may have been toxic exposures associated with that particular flood. Floods also cause significant mental health issues. As I mentioned earlier, floods can last a long time, especially riverine floods are known to last, they can go on for days, weeks, even months. And this long, drawn-out disaster that may not necessarily be highly acute can just be chronic over a long period of time. It wears out the disaster victims and it wears out the disaster responders. And so we have to be concerned about mental health issues when we're talking about these floods. And you can't underestimate the amount of impact in mental health and in wellness that floods can cause, and not only floods but other type of disasters. I want to share with you several different studies that were performed, actually one in the UK, one in the United States, and one in the former Soviet Union. And each one of those were looking at people 5 years out after floods. So let's picture this. People were displaced from their homes. They were, during the flood itself, they were replaced back in their homes, everything recovered, and so to speak, recovery was complete, right? They got their homes back, they moved back in, things settled back down. 5 years later, those people were still found to have premature death as compared to people who were not displaced from their homes. So floods by displacement alone, when we talk about someone who's moved from their home, you can't underestimate the kind of impact that that makes in long-term impact in your lives. One of those studies, for example, looked at stress hormones that are going in your bloodstream 5 years out after, still present in elevated levels after people had already supposedly gotten their lives back. So mental health issues, remarkable in floods, and perhaps one of the longest standing health issues that we can identify in floods at this point in time. We also know that chronic diseases like diabetes and emphysema and heart disease and the kind of chronic diseases that we see in high-resource nations, we know that those worsen on any natural disaster, and certainly they worsen in the case of floods as well. We also see something specific with floods in relation to mold and mildew that occurs inside of homes and inside of buildings and workplaces and so on as well. The drywall that we many times use to create the walls inside of our home has a calcium carbonate component in many of these styles. And that calcium carbonate actually attracts mold. Mold likes that kind of a mineral. The mold will seek out that and grow on that very easily. So if that kind of board gets wet, if that kind of material gets wet, it soaks up the water and then mold can start in that. And sometimes it can start on the backside where you normally wouldn't see that. That mold, however, when we breathe that in over a period of time, can cause lung issues. It can cause infections. It can cause chronic kinds of problems like exacerbations of asthma, worsening of emphysema. So we have to recognize that mold and mildew are other problems that long after the flood waters have gone away, these are the kinds of exposures that we have to really be cognizant of. Infectious diseases, as I mentioned, are all other causes of flood-related morbidity, and we talked about the difference between high-resource nations and low-resource nations with respect to infectious disease. And the other thing we have to recognize is contaminated water. Even though the flood water may have gone away, actually during the flood itself, it may have actually contaminated wells. For example, in the Great Flood of 1994 in the Mississippi River in the central United States, this is our largest river in all of the United States here, we had concerns about actually contaminated water in those areas. And what we found is actually some of the wells were actually contaminated not only by bacteria, but also by chemicals that were carried by the floods. And so we have to also think about our water supplies and are they still safe when the flood waters go away? Let's look again at those public health consequences in this particular table now. As I promised you before, we're going to go through them one by one, each of these disasters having their own table. And I want to point out here the number of deaths actually changes a little bit when we're talking about high-resource nations compared to low-resource nations, right? So we know that the number of deaths associated with floods is much, much higher in these low-resource nations where people just don't have the resources. They don't have the capacity to be able to deal with them, and therefore the death rates go much higher. The warning systems are worse and so on. So people have less of an opportunity to be able to protect themselves, and therefore we have larger numbers of deaths. Other things related to floods are actually relatively moderate or focal to widespread depending upon that specific instance. Some rivers flood. When they flood large areas, as I mentioned, like the delta regions and the topographical differences among these. Others are relatively focal, maybe only one particular neighborhood that floods or one area very close to the river that may flood. So there's some variability as far as these different areas that would include displacement, access to water, food, sanitation, and all those things that we said were related to that shelter cluster as well. There are measures that we can apply that lessen the health impact of flood disasters. And as I've pointed out with many other types of disasters as well, number one is evacuation. If we can learn to evacuate our populations out of these high-risk areas, that's how we save lives. You simply can't drown if you're not in the water. So that's the big issue with flood disasters, is recognizing that it's coming and getting those populations evacuated. And as I've pointed out to you before in the past, that's easier said than done. We need to involve people in the planning, involve people in the exercise of evacuation, involve the community in such a way through their traditional leadership, through their religious organizations, through their work and through schools and business and so on. Get people involved in that process to know where to go, when to go, and how to get there. That's the most important lesson that I can share with you about disasters in this entire seminar. So there are ways for us to prevent floods. We can control them, we can mitigate them, but it takes a conscious effort. There are natural factors that actually lessen this impact. Barrier islands limit the amount of flooding that can occur in some areas. Mangrove forests also help reduce coastal flooding. Also, respect for marshes are a big element in preventing flooding. You know, marshes actually, they're wet, they're soupy. You know, people don't necessarily want those outside their door when you're talking about developing or putting in a new subdivision and so on. So in the past, when we've developed these areas, what we've done is we've actually gone through and removed those. But you know, marshes actually work as a sponge. So when the rain comes down, that marsh absorbs water very slowly and absorbs just like a sponge, soaks up a lot of that water, preventing the flood. Then when the rain stops, those marshes let that water go very slowly as well. If we go through a floodplain area and go through where the water is collected and water from the rain itself, and we destroy those marshes, we increase the propensity for us to have floods downstream. So we have to respect those natural factors that limit the amount of floods, that prevent floods from ever occurring. So there are also structural factors that we can use, the things that we can build and things that we can apply to be able to lessen the impact of floods. One of them, of course, is dams and a system of levees that control the flow of these rivers that have propensity for floods. Seawalls also help us, and even at the last minute, sandbags can help as well. And so, you know, we have to recognize that there are structural and natural ways to be able to prevent those floods, to manage those floods, to lessen the impact of floods in the future. And also, policies for prevention, control, and mitigation of floods are very important. Land use planning. How do we use these floodplains? How do we manage them? How do we develop the floodplains in such a way that they lessen the impact of future floods? How can we apply coastal zoning in such a way so that we minimize the impact of floods as well? How we use the land today makes a big difference in whether or not it's likely to flood tomorrow. We have to think in terms of the future when we start working in these areas that are prone to flooding. So we have measures that we can lessen the health impact of flood disasters, and that's what I really want you to learn in this particular episode. Healthy buildings, you know, buildings that withstand floods, we can build those. We can build structures that actually lessen the impact of floods in a community, and we need to think in terms of a community-wide system for flood mapping, a hazard mapping that maps where floods can occur, monitoring the water levels and the rainfall levels so that we can forecast future floods, and providing early warning to those populations that are downstream that may potentially be affected 4 or 5 days later after the heavy rains in one area or the other. I want to share with you a perfect example of that that's happening right now in Vietnam. You know, one company in particular, Hitachi, this company actually had a wonderful idea. You know, they didn't want their factories to flood. So what they did is they went to the Vietnamese government and they said, look, you know, we want to be able to help with this. And they helped the Vietnamese government establish rainfall detectors in the mountains that would measure the rainfall itself and actually report that. And they were using that and also monitoring the rivers itself downstream. And therefore they could predict where the floods would occur by rainfall that occurred yesterday. We can predict tomorrow where the floods may be. This was a perfect example of public and private partnerships that established flood mapping, monitoring, forecasting, and early warning. And then because of that type of knowledge, we can then promote sustainable development in locations that are safe from floods, factories that are not disrupted because of flooding, people's livelihoods are not disrupted, homes not disrupted, populations not displaced and 5 years out still having problems getting their life back together. So promoting this sustainable development in areas that are safe from floods, very key long-term approach. And finally, supporting policies for land use regulation, again, in high-risk areas. And this land use regulation has to include agriculture because, as we learned before, poor agricultural practices that involve overgrazing or wrong kind of planting in certain crops that tend to decimate the soil more than others. So we have to support these policies for land use regulation in high-risk areas, including agriculture. And of course, in addition to reducing the exposure, we also want to reduce the vulnerability. And I've mentioned this is one of my favorite approaches as well. Improving people's health, improving and sustaining their personal mobility, even to the extremes of age, improving their social network and their public knowledge and their preparedness, and improving communication and the social cohesion that brings the community together to work together. These are all things that create healthier people, and we know that healthier people survive disasters better. So I told you about exposures and reducing vulnerability, and the other thing, of course, the third thing is building capacity. We want to build capacity, and that makes people resilient. It makes buildings resilient. It makes communities survive. So we can ensure better education, better economic choices for people, better health care makes healthy people, and healthy people survive. Healthy buildings survive as well. We can select key structural and non-structural mitigation measures. What does that mean? It makes making buildings survive floods. And then healthy communities survive as well. We want to practice large-scale population evacuation measures where populations can be removed from this threat. Location, location, location. And it's the same thing for flood disasters. We want to maintain early warning systems so people get an advance notice so they can take protective actions. We also want to develop critical infrastructure that's resilient, it's not flood prone. So water treatment plants commonly are associated with flooding. And we lose the water before we lose anything. It's like that rhyme of the Ancient Mariner, isn't it? It's water, water everywhere and not a drop to drink. If the first thing that gets flooded is your water treatment facility, and maybe that's the only thing flooded in the community, everyone in the community loses their water without ever maybe even being flooded at all. So critical infrastructure, protecting that during these floods are very, very important. And finally, we want to promote the social cohesion and involvement of the community, bringing people together ahead of time so that they can work together during these times of trouble. Really, it empowers people, it gives people the feeling that they've done something, and it really gives them a stretch towards the future, an empowerment that they can then say, I made a difference in people's lives.